Mahesh Patil. Let's welcome in a very special guest now. Mr. Pillai from Aster Healthcare DM is now with us. Sir, you wear a lot of hats, whether you talk about the Middle East, whether you talk about the Indian market, whether you talk about the diagnostic market. Can you just first tell us what are the trends that is visible across various regions that you operate, where things are looking in not that great, where, suddenly there has been a shortage of every product that one supplies in the healthcare space?
Seeing various trends in different markets, I would like to take all of you back to 2020. At that time, when we had the tough physical lockdown in Q1, what we saw in our group hospitals in GCC, specifically in UAE and other territories, is that the pandemic wave there was much earlier to India, and we had this extraordinary situation where in April, May, June in 2020. We didn't have, hardly a trickle of COVID cases coming to our hospitals, where the clinical teams in GCC were flooded with COVID cases. And there was a lot of knowledge share and experience share about what to do, what not to do between the clinical teams, between the two territories. The first wave, if you look at the geographies, we run hospitals in Maharashtra, we have units in Telangana, Andhra Pradesh, Karnataka, and Kerala. We found that the wave was, it was coming slightly from Western India, then to Southern India, and then finally to Deep South. Just to highlight this specific point, we are the leading providers in the state of Kerala, and we found that last year it was after the Onam festivities, where I guess people were, lowering their guard, and that was the last geographical cluster in our experience to be hit with the pandemic. And then, of course, post the first wave, things got really better, and we were all having a huge sigh of relief. And of course, now we can see the trends are just peaking up. Of course, right now, if you look at our hospitals in Bangalore, we are facing a huge challenge because clearly Karnataka is. The numbers are just climbing day by day, and as per the mathematical projections, what we have access to, the peak is yet to come. Peak in Karnataka is supposed to be somewhere between 1st to 11th of May is what we are told. So we are bracing ourselves to meet all eventualities. In Maharashtra, what at least because of my hospital in Kolhapur, things are still grim there, but we don't find the numbers, the number of positive cases in the same frequency as before. So maybe it's plateauing in Maharashtra, whereas it's just starting to peak in other states. So it's kind of mixed. We are not finding one uniform story in all the geographies where we operate.
Right. An important point you mentioned that, last time around people did not know what was happening in terms of COVID, what was the treatment, is there a vaccine, what's the protocol. This time around, yes, the number of cases are higher, but you think there is a treatment protocol as well, which of course was missing, and that's why everybody was scared last time?
Sometimes, it's an interesting question in terms of behavioral. So I would classify the population into two: healthcare workers and the non-healthcare, the Aam Aadmi, so to speak. So if you look at healthcare workers, clearly there was an element of fear, specifically in India, when we were just, beginning to witness what was really happening. At that time, a lot of our clinical leads were quite busy attending webinars, international webinars, to hear experiences from colleagues in China, Southeast Asia, from European countries and United States, which was really at the center of the storm, so to speak. So there was that kind of element of fear, and also what works best. What is the kind of protocols we have to follow? In that context, the Indian Council of Medical Research, ICMR, had done a key role in publishing protocols for the Indian, for Indian practitioners to follow through, which was really a kind of a big relief for us. Right now, when we look at the second wave, that fear among healthcare workers is absolutely not there, because people know what to expect. But the disappointment, so to speak, was at least in the common citizens. I think what has really let our country down was that people just thought that the worst is over, and somehow being Indians, we have some sort of extra immunity or protection. I think lowering of our guard and the vigilance by our citizens, not following the common sense protocols of wearing a mask, social distancing, hand hygiene is something which has really affected us. One pattern, if I may say, is that unlike in the first wave, we are finding a lot of family clusters. We find that if in the earlier first wave, if you look at the demographic slice, it was much more 55 years plus. Right now, we are finding a pattern of younger age group between 40 to 55. And we also, when we do contact tracing, and when we try and find out much more about the history of contacts, we really find that the younger working age group who were mobile, walking around, school-going kids who could be asymptomatic carriers, these are the folks who are bringing the bug into family groups, and then they becoming clusters. So this is one interesting demographic trend in the second wave, what we are witnessing.
And I completely agree with you, Dr. Pillai. Hi, this is Mubina as well joining in. I think more often than not, we have seen Indians thinking that, okay, we are done with it, now we can, get on with our lives. And then suddenly the next thing you know, there is a second wave that has come in, which is, I suppose, disheartening a lot of people and also making them think that, okay, we don't need to follow the same protocol as we did the last year, or it's sort of they're not exactly incentivized to follow the kind of protocols that we did the last year. Very disillusioned as well in many cases. Dr. Pillai, I want to understand your take on the medical infrastructure. Of course, like we said, that we headlined this as well, that many hospitals have been calling out for oxygen, that desperate call is reverberating across hospitals. And now this is a commodity that's very basic, in every hospital. Do you think that our medical infrastructure, and it clearly seems to be the case, is not equipped to handle more than 3 lakh COVID cases in 24 hours?
It's just, all of us, we know the numbers in terms of bed to population ratio. It's rather skewed in our country, isn't it? When we look at, we have a north-south divide where southern states have always had the larger concentration of large teaching hospitals, or the largest concentration of medical colleges in India is in southern India compared to any other part of the country. Same thing with the other cluster is urban-rural divide. We have also a skewed concentration of hospital beds in the private sector, specifically in the urban centers, compared to the rural area. So that divide is already there in our country. Now, to compound it is that you anyway have, if you remove the pandemic, we have an ongoing challenge with non-communicable diseases. Because if you look at South India, we have a rapidly aging population compared to the young North India. So most of us in our day-to-day working lives, we are anyway facing a large rush of patients having, let's say, cerebrovascular events, what we call as stroke, neurological strokes or cardiac events. And urban centers are also facing a challenge of a large amount of road traffic accidents. So this is like a day-to-day life. But when you talked about the shortage of basic infrastructure like oxygen, it is all to do with the sudden rush. Nobody, one visual analogy, if I may say, is that when you looked at the natural deluge which impacted Kedarnath, we all remember the visual. This is like the medical equivalent of the Kedarnath catastrophe. Nobody can ever plan for such kind of a pandemic. But, having said that, what we have to do, we can only look at that this is not the end of this pandemic because there is a long way to go where our country is concerned to speed up the intensity of vaccination, because that is one silver bullet which we do have. So between this wave, what we are currently facing in our country, what experts tell us is that we might see probably the end of or the waning of this wave sometime by end of May or first week of June. And it is also postulated that we will face with the third wave. But the whole idea is that the intensity of these waves should be brought down. The peak of the curve, what I mean, should be brought down progressively, because if more and more of the population have got herd immunity, it really helps to help us quite a bit, and that can only be happen through vaccination. So in the interim period, it's when we need to boost up our supply chain systems and our infrastructure. So, answering your question, yes, because we are in this acute deluge of patients, we do have challenges in terms of oxygen shortage. It is not pan-India, I must tell you, because at least in the geographies where Aster operates in India, we have a network of 14 hospitals across 5 states. We have not yet encountered that challenge of oxygen shortage. And I must thank the respective state governments and district administrations who have been obviously looking at what's happening across the country and making efforts proactively to ensure that essential supplies to medical facilities do not face any sort of shortfall.
Okay. Well, it was lovely having you with us today, Dr. Pillai. So maybe end of May, first week of June is when, these things will pass out. There is a possibility for third wave as well, but it's important that the intensity goes down. For now,